Welcome back. Molina Healthcare provides managed healthcare services. That's under the Medicaid and Medicare programs and through the state insurance marketplaces. Well, they are now in partnership with the New Mexico Caregivers Coalition to recognize 19 students from the Santa Fe Indian Schools Health Careers Program as with $1,000 scholarships supporting their future education. We are joined this morning by the Director and Member of Community Engagement from Molina Healthcare, Buffy Saavedra, along with Yvonne John, telling us more about this wonderful partnership and program. Ladies, welcome to you both.
Thank you. Good morning.
Good morning. So let's start off talking about the partnership with Santa Fe Indian School.
Sure.
Yeah.
Excellent. So we at Molina Healthcare of New Mexico work with our foundation called the MolinaCares Accord to support community organizations across the state. That includes our educational systems. It's a special partnership with Santa Fe Indian School, SFIS for short, and that partnership involved their Health Careers Program, specifically for those that will directly serve individuals in their communities, like the community health workers or representatives, as is the term on the tribal community or within tribal communities. This partnership allowed us to provide the students who graduated this past year. There were 19 from that program. They're graduating high school, but they're also graduating from this additional piece with $1,000 scholarships. And the Caregiver Coalition partnered with us to produce these scholarships.
Yvonne, let's talk about your role in all this.
Yeah. So my role is instructor at Santa Fe Indian School, but the program started actually, the Health Careers Program started is introduced to students back in 2008-2009 school year by way of a grant from UNM School of Medicine. And the purpose is to engage students in focused, community-based, contextual educational experiences that support and encourage those students that want to go into the health careers. So the long-term benefit to the success of this program will go toward benefiting health outcomes for the communities and the families where the students reside. So a little bit of history is, back in 2008, we did start out with one elective course with 14 students that basically just included expert guest speakers and related field trips to give them a little bit of a eye-opening experience in what a day in the life of a healthcare worker would be. But as popularity of the program grew and students expressed their commitment to a post-secondary education in a healthcare profession, we decided to engage in a partnership with the Santa Fe Community College to create a more rigorous dual credit curriculum that would really serve as a preparatory program for the students as they're going through their high school education. But today we have about 150 students in the program, 6 different dual credit courses in which the students are originally enrolled as sophomores, but by the time they're seniors, they can choose to study to become certified phlebotomists and or community health workers.
Wow, pretty amazing. And again, no doubt, $1,000 scholarship is going to come in handy for these young men and women. Buffy, this partnership here, how much of a big thing is it to be able to partner with the school?
It's amazing. And Santa Fe Indian School is comprised of students that come from all parts of New Mexico and tribal communities. So some of the students, as you said, about 75% are actually housed there. They have a dorm. It's almost like college. I wish I could have done all that if I was Native American. That would have been wonderful, because of the experience from the education to the extracurricular to the sports activities. You probably saw the girls basketball team, I think it was, had a really great season, as did softball. And so they go back to their communities and they serve. And many of them, you would just be amazed. They're going on into the medical field, like onto college right away to become biologists, to go in to become doctors and surgeons and all sorts of amazing opportunities. And so many of them wanted to intern later this summer in the early fall in their communities and serve their communities, and it's just amazing. And we have such a healthcare shortage here, especially in our rural and tribal communities. It's wonderful to see the youth care about their own.
Absolutely. And it's wonderful to see partnerships like this that can, kind of make those scholarships a reality for these young men and women.
Yes.
Thank you both for joining us. We appreciate it.
Absolutely. Thank you for having us, and thank you, Yvonne, for the opportunity.
Thank you, Bucky. I appreciate it.
Now, for a full recap of the entire interview, we will have it later on this morning. You'll find it on our website. That's always on krqe.com.